So using an active robot is like taking the sugar out of the sweets, or maybe a fragrance out of the flower, art out of the artist, maybe a love out of a relationship, and probably a surgeon out of the surgery. So there are driverless cars, and if you see the data in last year, there are 400 accidents with the driverless cars, and the most were with the most famous company, Tesla. So they are not absolutely safe to leave your most precious life in the car to a driverless car. If we go in the literature, there's not much to talk about the active or semi-active robots, but the few things in the literature review published this year only. And it says that the iatrogenic injuries during the surgery, maybe it's a soft tissue injury, a bone injury like the patellar tendon injury, even the common peroneal nerve injury are much more common with the active robotic system. And if you see the conversion from robot to conventional technique is only with the active robotic system. Has never been reported with the semi-active robotic system. So these are the facts available in the literature that semi-active is much better than the active robot. Now what are the problems if we see? So there are higher chances of conversion to conventional technique with the active robot. There are higher complication rates, which is proven in the literature. There are more number of pins to stabilize. Now there's a clamp available, but I know many surgeons who are still not using the clamp, but they're still using the pins to hold the 2 extra pins, one in the femur, one in the tibia, to hold the leg together so that while robot is cutting, it doesn't move. And more complications of those pins. So we all know that while we're cutting the bone, we know we have the feel of the bone quality. And that makes a lot of difference in your post-op protocol and your planning in the post-op management. So that feel is completely gone because the bone cuts are taken by the robot and you don't have any feel of the bone, what kind of bone it was there. And you're not able to extend the boundary of the cut because you don't want the robot to go in the soft tissue, and surgery is completely passive. There's no real-time guidance to the surgeon. So what is semi-active robot? In the semi-active robot, the surgeon is doing the surgery and he's getting an audio, visual and a tactile feedback during the surgery, and it helps in cutting the bone in the femur and tibia. Now all the disadvantages of the active robots are the advantages of semi-active robot, that there are less complication rate, there are less number of pins, and you can assess the bone quality. We are an orthopedic surgeon, we need to know how is the bone of the patient. And surgeon can extend the bony boundary if required or desired in that particular case. And surgeon is actually playing an active part. He's not just passively standing there. And there's no reported conversion from robot to conventional technique. Now, few emotional points. I want the robot to assist me, not to replace me. So I want to go hand in hand. Robot is a good thing, but I don't want to just be like a resident to my robot, opening the joint, he does the job, and I put an implant later on. So I don't want to be resident of a robot. So I want to remain as a boss in the OT, and robot should be a resident of mine. I thank you all for patient hearing. This is a very small debate.